Welcome back to Preferred Medicare. I'm Holly Cohen, licensed independent broker, and today I will be discussing with you the perfect storm happening right now during this 2025 Medicare annual enrollment period. Here's the scoop. 28 health systems are dropping Medicare Advantage plans. That's right, 28. I don't mean 28 hospitals or 28 doctors. I mean 28 healthcare systems that are multiple doctors and hospitals throughout the country. This is affecting thousands of patients. You enroll in a Medicare Advantage plan. You are handing over the keys to an insurance company. They get to decide what's covered. Yes, they must cover what Medicare covers, but it is very different when you have a publicly traded insurance company in charge of your health care. Now, let's talk about some legal challenges and the use of AI in decision making that's happening among the major insurance carriers in the country. Many major insurance companies are facing lawsuits for denying claims, and guess what? Some of those decisions are being made by AI. That's right, machine learning. So many hospitals and doctors are leaving networks of the major carriers. And why? Because they're losing money. There's a lot of denial of claims, and there's a lot of claims not being paid. There's a lot of overbilling and upcoding that happened a few years past. And so the hospitals cannot afford to stay open and still take these Medicare Advantage plans. So that's why these big healthcare systems are leaving these plans. Many of the Medicare Advantage plans set for 2025, you may be on one, have gone from a $0 premium to a $21 premium in some cases, a 40 some odd dollar premium in some cases, over $80 in some cases for just the monthly premium. At that point, you could go and get a Medicare supplement plan. There's a lot of hurdles that you may have to go through to do that if you're not healthy. We just had a client that enrolled with us on October 15th for a Medicare Advantage plan in New Hampshire. Then they found out on their local news that this insurance company is no longer going to be servicing the hospital system in this area of New Hampshire. It's a big problem. So now I've looked at other plans for this couple who couldn't go with the first option that made their prescriptions come way down. Now we looked at other companies and it made their prescription costs go up. So now they're going to have to pay more in their prescriptions. They can't afford to switch doctors. To get them back onto traditional Medicare, original red, white, and blue Medicare is not the hard part. You can call right now Medicare and you can get back to traditional Medicare for January 1st. The problem is Medicare supplement plan that you would need to pay the 20%. After original Medicare pays the first 80%, you would have to go through medical underwriting in order to get a plan G or a plan N, which is a supplement that works with real Medicare. Medicare Advantage, remember, you handed your keys over. So it's up to those insurance companies then to determine what networks, what doctors and hospitals that you can see. So let's take a breather and break down original Medicare. It's made up of parts A and B. So think of it as the classic diner of healthcare. Sure, it's not gourmet, but it gets the job done without all the extra toppings that come with some plans. So what I mean by that is original Medicare, Part A and Part B pays the first 80%. No, it doesn't pay the 20%. That's where a Medigap plan, Medicare Supplement, or N would come in. And no, it does not give you free dental or free vision like the Medicare Advantage plans do. But the Medicare Advantage plans do not come without problems, especially this coming year that's ahead of us. Again, please do a plan review. Call your agent. You can call us 855-265-6334 and we can help you. Or you can call Medicare to find out if your plan is changing for next year. If you want to go back to traditional original Medicare, that is an option right now to do. Again, you will have to go through those challenges of getting coverage with underwriting. If you're healthy, it's no problem. If you take quite a few medications, it can be a problem and you can have a denial of coverage. So here's something else If it's your first year on a Medicare Advantage plan, you have what's called a trial right period. This means that you can still switch to a Medigap plan with guaranteed issue rights without answering any of those medical questions and going through underwriting. If you started Medicare Advantage and you're in your first year, if you've had a Medigap plan prior, you can go back to that Medigap plan that you used to have. But you can only have been on Medicare Advantage for 12 months to be awarded that trial right period. The other way you can get trial right period is if you're new to Medicare, you're in your first year of having Medicare, and it's your first, and you're within your first 12 months of the Medicare Advantage plan, you're also allowed to have trial right. So if you found that your Advantage plan is not available for you for next year, and you're facing problems because of that, and there are thousands of people across the country. Again, perfect storm. The Inflation Reduction Act capping everything at $2,000. The insurance companies that are publicly traded insurance companies, their stocks have plummeted because of looser regulations a few years back. And now there's been a crackdown of regulations this year, last year, these Medicare Advantage plans. Now we're faced with a couple of things that are hitting us like a no pun intended. I live here in Florida. We were actually saved. We're down in the southeast portion, but it really feels, I mean, this opened right when that hurricane started barreling over to my state and it was not fun. Medicare Advantage, I've used to joke, it's like putting lipstick on a pig in a lot of ways because they take you, it takes original Medicare. And it puts you on to a publicly traded insurance company, their plan. And if their stocks aren't doing well, or if there's government restrictions have cracked down on them, or there's lawsuits, or there's just things happening to these big insurance companies right now. And unfortunately, the Medicare beneficiaries are the ones that are paying the price. You have to do a Medicare 2025 plan review. You have to make sure this year that you do that because you don't want to get hit in January going to your doctor and they don't take your plan. So let's do a quick recap on the difference between original Medicare versus Medicare Advantage. Original Medicare allows you to see any doctor that accepts Medicare. Original Medicare has deductibles and coinsurance, which are filled in with a Medigap plan. Medicare Advantage may have lower monthly premiums, but it can really hit you with high out-of-pocket costs. Medicare Advantage plans do often come with some extras, but make sure you know what's really in there before you just look at the extras. What to do if you're affected by these changes. If you find yourself affected by these changes in Medicare Advantage, it's time to consider either switching back to original Medicare if you can and enrolling in a Medigap, or looking at a new plan for next year. Remember the dates, October 15th, today's already the 17th, it runs through December 7th. So do not delay. Make sure you call your doctors, see if they're going to take your current plan for next year. If you want to switch back to original Medicare, again, you can call your agent. You can give us a call at 855-265-6334. And if you would prefer not to talk to a real human, you can go on our website and look up information, plangfinder.com. Remember, it's not just about finding the best plan. It's about avoiding those surprise hospital bills, or walking into your doctor's office and in January and them telling you that they no longer take your plan, because then it's almost too late. So if you have any questions or you need personalized assistance, feel free to reach out to me or Steve, my husband. We're both licensed agents. We are happy to answer any questions you have. Don't forget to like, subscribe, and hit that notification bell. I'm going to try to put as many videos out as I can and still keep helping our clients. Remember, knowledge is power, especially when it comes to your healthcare and your Medicare. Until next time, and as always, please be well.